This is County Talk. I'm Eric Schmidt. Thank you for tuning in. In a very real sense, life as we've known it for the last 14 months or so is once again changing. No one knows if it's changing for the better or if it's changing for the worse, but one thing is for sure, we're all in it together. Helping guide us through the next phase of big change in Washington County is the Washington County government, led by the Board of County Commissioners and its chair, Catherine Harrington, who joins us now in the studios of Tualatin Valley Community Television. Chair Harrington, thank you for joining us, and it's wonderful to see you in person.
Thank you, Eric. Thank you for inviting me, and it's wonderful to see you and get to talk with you without wearing a face mask. Isn't it great?
Or seeing you through a screen on a laptop.
I know.
We're done with that. We are recording this edition of County Talk on Wednesday, May the 26th, 2021. On Friday, May the 21st, 2021, Washington County went from higher risk to lower risk on the COVID risk scale. I assume that's good news.
Yes, it's terrific news. So the state is now tracking things based upon the number of people who get vaccinated, of those eligible. Now, we now have a situation where those between the ages of 12 and 16 can get vaccinated. But since the state has been tracking the prior segment, 16 years old or higher, they're sticking to that measure. Here in Washington County, thankfully, over 65% of those eligible have been vaccinated. But we still have work to do. We need our community, all of your friends, all of your family members, all of your employees to get vaccinated so we can remove all of those restrictions. The vaccinations are our best tool. I am so looking forward to everyone having the opportunity to slow down a little bit this summer, to get out and about, to visit their friends and their families. Vaccinations help make that happen. And then, of course, I'm really looking forward to the new academic school year and the opportunity to get kids back into the classroom full time. But in order to do that, we need to keep this full court press on. So please, everyone, get vaccinated.
Message heard. Are there enough vaccines available, and can they be readily accessible?
Yes. The access to vaccinations has changed greatly. Everyone 12 years of old or higher has access to vaccination, of course, through your doctor's office, but local pharmacies, and we continue to have local clinics right here in Washington County as well. Vaccinations are available.
What's it going to take to wipe COVID out? Or is that even in the realm of possibility?
Well, the whole family of coronaviruses, like the flu, it's a virus, will continue to be with us. But what we're trying to do is get the threat of this virus to your health, my health, our greater community health down significantly. So I've been getting a flu shot each autumn in order to reduce my level of my risk of getting the flu virus. That may be appropriate for this SARS-CoV-19 virus as well. But, we've been at a pandemic level with this virus. We're trying to get it down to how do we just move forward with living with it safely in our communities. It will never go away. It's here.
But we all may be wearing masks for the foreseeable future when we go out into places.
Well, it depends. We've been living with the flu without masks. So it really depends upon what each of us, you and I, all of our friends, our family, and our coworkers do.
What do we want to do? The past 14 months, I would imagine, have been pretty stressful for local governments. I think that's probably an understatement. At the very least, the learning curve kept moving up, and you and your colleagues had to be extremely nimble in how you governed. Have we just witnessed a significant shift in how public services are provided and will continue to be provided?
Well, public health has been part of the county portfolio for generations, really. What has occurred for decades now is that we have underinvested in our public health system. I mean, look, when I was a really, really young girl, I had to get vaccinated against the polio epidemic, right? And I've been blessed to live for 50 plus years without there being a significant health risk like we've all been experiencing this past year with this coronavirus global pandemic. Wow, we've been really fortunate. Our public health system has really responded, but all levels of government have learned that we're going to need to maintain a high level of readiness. The medical community, our science community, has informed us over this last year that we need to be prepared for the next one. So there's not going to be any sitting back and going from there, but rather learning from this and ensuring that we continue to maintain a level of planning and readiness.
No resting on your laurels.
Nope. It's been an incredible learning opportunity, as you said.
I'll bet. The economic impact, when you and I talked in March 19th, March 18th last year, a million years ago, we didn't really have an idea of what the impact would be. It really kicked us, didn't it?
Yes, when you and I got together last March, it was right before the shutdown, the first shutdown. And we've had multiple shutdowns since then, right? We had another one in November through the holiday season because of the concerns of what was happening with the growth of the virus spread in our community. Our community has responded. Businesses are opening again, returning to work. We do still have some disruption going on because working parents are still having to deal with some extraordinary flex in their days, demands really. We don't have our children back to full-time in classroom, and that's why it's so vital that we all continue to get vaccinated so that employees can be working on site again to meet their customer and workplace needs, and that more of our businesses that have been working under tremendous restrictions can once again operate without those restrictions. Those restrictions have been in place to protect our public health. And this is where, with vaccination availability, we can reduce and remove those restrictions.
So Washington County will continue to be the economic engine of Oregon?
Well, we are certainly blessed here to have firms, small, medium, and large. And they haven't gone away. They've pivoted their operations. Different manufacturing companies have had and will continue to have face-to-face operations, and we've done a lot to support their workplace environments to make sure people are protected, their employees are protected, and where there have been outbreaks, to respond and to support them as swiftly and as effectively as possible so they can get their operations back to productive levels. We're blessed here in Washington County. It provides for a great deal of employment, not only for our community members, but also for income taxes for the state of Oregon.
Speaking of which, you are in the middle of a budgetary cycle. You have to have a new budget by June 30th.
Yes.
The fiscal year starts July 1st.
Yep.
I would imagine that these negotiations are pretty intense this year because the revenue hasn't exactly been up to what you've expected in the past.
Well, it's not so much the lack of revenue, because property taxes have remained stable. Some of our fee level is reduced because of economic activity, but really the crux of the issue is that a lot of the work that we do involves people and personnel. And the costs for salaries, medical benefits and retirement costs have exceeded the growth of revenue. And so that's where just to keep our current service levels with existing employees, we're having to reduce in other areas, hold positions vacant, reduce costs in materials and services. But if you think about it, we have, through the Sheriff's Office Law Enforcement Patrol, they're out in our communities driving cars. The price of gas has gone up, right? In our jail, because of safety protocols, we have had to reduce the adult in custody level. There continue to be operational costs with this virus. So costs have outpaced our revenue. That's the meat of the problem.
As you said earlier, we have underfunded public health over several generations. Has the legislature at all stepped in to help with some of that funding in those areas?
Yes. The Oregon Health Authority has submitted a budget request in order to advance the underlying technology. Everyone's heard about contact tracing and keeping track of the information, and OHA has done a tremendous job. You know, they get a lot of criticism because they're delivering news to us that, we just want things to go back to normal, but they're helping us better understand what the situation is and be pragmatic. But they've used databases that were put in place for a much lower level of activity, like tuberculosis and HIV in our communities. And pandemics require a higher order, a larger volume of data, but also the symptoms that they have to keep track of, the demographics of our community. I mean, we've wanted to know how does this impact people of different incomes? How does it impact people of different races? The face of our community has changed, but we have not supported through governmental budgets having the effective databases necessary, that infrastructure, all important word, in place for them, for these epidemiologists, these scientific experts to do the work that we're asking them to do on our behalf. So that's where we need to invest in ourselves.
Has the legislature heard this message?
Yes, and the governor has heard it. Unfortunately, with our state government being funded through income tax collections, when you have historic rates of unemployment, your income tax revenues are much lower. So they're doing the hard work of figuring out, how do we make sure we're making some investments in public health, enough investments in our school systems, and then of course the jails, and also other costs like the Oregon Health Plan, which covers a huge volume of residents here in Washington County. How do we fund all of that? I do not envy the job of state legislators. It's really hard.
And they have to deal with a kicker, but that's a subject for another program.
Yes.
We'll get into that later. You have a new county administrator.
Oh, Tanya Angie. She's wonderful.
I got to interview her. She had been on the job for about 3 months, and she was just firecracker. She had all kinds of ideas.
Yes.
You're comfortable with her performance thus far?
I am thrilled with her, as is the whole board.
Great.
She's really worked hard to develop relationships here in Washington County. She's been with us for 9 months now. I mean, her second week on the job, nature threw in wildfires, toxic air. So we had to shut our buildings down, at a time when we were trying to pull in fresh air due to the pandemic, right? We had to shut the HVAC systems off because of the toxic air pollution. Well, and then of course Mother Nature threw in a winter storm. All of that on top of normal work. But she has really established great working relationships, built teams in the county, and helped everyone understand what does the work of the future look like. And I feel really blessed that she has had the governmental and community experience that she does, because I'm looking forward to our initiating a new community strategic plan. And
took
she
my
has
next question right
expertise in that. Well, go right ahead.
Well, no, that was one of her priorities, was the 30-year strategic plan, which could end up being 15 or 10 or whatever you decide it's going to be. But it's an important part of planning.
It is. And we need and want our community members to be involved, because we know we have a complex community, right? We have varied demographics, we vary by age, we vary by the types of employment that we have, and we want everyone to be involved so that we can ensure your county government, which is a safety net government providing a whole vast array of services, that we do a better job here in the 21st century. We're sitting here today in May of 2021. Well, if we fast forward to the year 2030, what's Washington County going to look like? What are the service demands going to be like? It's not that far away, folks. How do we plan for our future? The community is, your future is what you make it. Let's make it a bright future for Washington County.
And if we don't plan, we could get caught behind.
True.
Part of the services that you provide is behavioral health.
Yes.
Taking care of people who have problems, substance abuse, mental health issues. There's a concept on the board right now for a CAT, a Center for Addictions, Triage, and Treatment.
Yes.
I personally think it's a grand idea, because this would be a central location where people could go who have problems to get the help that they need.
Yep.
Are you behind it?
Absolutely. Yes. A final feasibility study has just been released to the Board of Commissioners in July. In about 6 weeks' time, we're going to have a full work session review of that feasibility study. There are multiple entry points for people who are needing mental health and substance use disorder treatment support. And we need to increase the availability of services to meet the demands of our community. In order to do that, we need to build some new facilities. So we know that the real estate market here is really hot. We've been shaking that tree and looking at what are the lands and buildings that Washington County currently owns. It looks like through this final feasibility study that we're going to have to acquire some new properties and build some new facilities in order to provide the services that the community needs. It's going to cost a lot of money, and we have to figure that out. We're talking on the order of anywhere from the $40 million level to the $70 million level. And yes, that's quite a range, but it's all reliant upon what are the types of services that we want to co-locate together so that it is the easiest, most efficient way for those in need to get the services that they need. So it'll take us a little while to get that path anchored down, but the feasibility study is the very first step for initiating this work.
I think it's a really exciting concept, and it's online if you want to take a look at it.
Yes, it is.
A lot of the people who will be treated, who have these kinds of problems, are also homeless or houseless or without shelter, however you want to describe it. The nexus between behavioral health and homelessness, housing, affordable housing, is really acute.
Yes,
And
yes.
it's almost as if you have a housing service, you have to provide addiction services. If you have addiction services, you have to provide housing services. That's all part of the program, isn't it?
It certainly is. And we're really blessed that just last year, May of 2020, we had a once-in-a-generation opportunity, and the voters approved a funding measure to support what we call the supportive housing services, which allows us to ensure that as we help folks who have been chronically homeless or on the verge of becoming homeless, that not only are we finding them that temporary or more permanent housing, but they have the behavioral health services that they need, the rental assistance they need, the guidance with finding a job and consistent employment. It's an exciting time. It says a lot about our community that in the midst of a global pandemic, when schools were shutting down, businesses were having to close, that our voters chose to invest in this measure to help their neighbors get the support they need. So we've worked together. And really hats off to our community service providers like Bienna Star, New Narrative, and many others. We defined what's called a local implementation plan. The Board of Commissioners approved that last month. We had over 130 people actively involved in developing that plan, and it's before the Metro Council this week for them to approve it, and then the dollars start flowing to increase that service level. And we're also working really hard with these community-based partners, such as I mentioned, to help them increase their staff in order to provide these key services to help people live better lives. You can be really proud of the work that's been done, but the truth is in the telling. So in another year, I look forward to our having that annual plan that lets you know that we've been successful in providing 500 more units, 500 new homes for individuals, getting people off of living on the streets or in encampments, and getting the support they need to live productive lives. Getting our first ever year-round shelter created for singles and adults. It's just very exciting.
There's a nerd inside of this body that says this is really exciting stuff, but we can't dwell on it. The voters decided last November not to approve a transportation bond, which is kind of a blow to Washington County because we had a number of projects in that bond that we really could have used the money for. How the Board of Commissioners going to deal with that going forward?
Well, it is true that we know a lot through the Get Moving 2020 planning effort about what is needed, but we're stymied with having the resources to make those improvements in our communities around connectivities as well as safety for everyone to get around productively to meet their everyday needs. But your Washington County team has continued to work hard, securing federal dollars as well as state dollars through different grants to try and advance projects. I have a couple of examples for you. TV Highway. We have submitted a proposal through Congresswoman Bonamici's office to try and secure federal dollars to put in place additional sidewalks on TV Highway. So we're in the queue. We don't know yet if we're going to get funding. Then also with Aloha, another place where the word sidewalk comes up in safe crossing.
There aren't any.
Well, right. In Aloha, 40% of the residents in Aloha are low income, as well as high degree of people of color and children as well. And so we have another project where we've submitted applications for state and federal funding. So your Washington County team and your Board of Commissioners is dedicated to continue to find the money. We're also working with Metro. one of the major projects that was in that funding package was a new light rail line that we call the Southwest Corridor to expand light rail from PSU all the way down to Tualatin, because that's a very heavily used corridor and we need more travel options for people. Unfortunately, we don't have the local match that is required in order to secure that federal funding, but we're going to keep working on it. We're going to need the public's help.
Mayor Snyder and Mayor Bubenik are both very advocacies for that line, light rail line for sure.
Because it'll do a lot for the communities. It will help students get to our local universities. It will help employees get to and from work in a predictable manner. It will also improve connectivity as well as affordable housing in these areas.
Just real quickly, a question about Intel. We've been hearing all summer how they're ramping up their chip-making processes in Aloha in particular. Do you think that that's going to have long-term ramifications for Intel expanding and that we might have to be dealing with another Nike kind of tax break or anything going on like that?
Well, I can't comment about specifics that Intel may or may not be thinking about, but boy, aren't we blessed to have Intel here in Washington County, but also in the United States. 70% of their manufacturing capacity is here in the United States. And right in Hillsborough, we have their development fab at Ronler Acres. So they test new technology and then implement that at other factories here in the U.S. as well as in other countries. Because of that, there is an incredible wealth of highly trained scientists, physicists, and more, computer engineers, manufacturing technicians that Intel employs and live right here in our communities, contributing to the wealth here in Washington County, supporting our schools, for example, supporting public health. So we're very fortunate to have that.
Yeah, it's all good news, basically. Coming from an Intel alum, I think that's probably good words there.
Yes, I was fortunate to have a great career at Intel and in high tech.
We have to close this out, unfortunately, but I do have one last question for you, and I think it's safe to say that the job you have today isn't the job you thought you were going to have when you were first elected. What are your thoughts about being chair of the Board of County Commissioners today after 14 months of pandemic impact?
Phew! What a year plus it has been. But I am gratified that we've done terrific work together to address affordable housing and homelessness, to look at the support for local jobs in our community. I'm really proud of the work that we've done to put in place the first ever pre-apprentice program here in Washington County. Also another program to ensure that your tax dollars, as we have contracts to build buildings or to buy materials, contractors, that we are looking at our minority women and emerging small businesses so that we're getting the job done, but also increasing our workforce at the same time. Transportation, we've already talked about that. Community engagement is another one. Look, we now have town halls with county commissioners. We have better access to your elected officials thanks to Zoom and all these virtual meetings that have become part of our normal everyday operations thanks to this pandemic. We've learned a lot together. I am really honored to have the opportunity to work on behalf of the residents here in Washington County and to try and help everyone lead a better life. I just love Washington County.
And you still like the job?
Absolutely, absolutely. I want to keep doing it.
Catherine Harrington is the chair of the Board of County Commissioners in Washington County, and it's so good to see you again in person. It really is. It's made my heart warm. Thank you for doing that.
Thank you, Eric. Thanks for having me.
And this is County Talk. Thanks for joining us. We'll see you again next time.